I'm going to show you the proper way to document in a patient's chart after you have administered medication through injection. This is a view as if you were looking in a patient's chart, and a lot of different electronic medical records automatically input the date and time and your signature for you. But since I don't have any electronic software, I'm going to show you how to document as a regular standard way without using any particular software. So the first thing I need to do is I need to indicate today's date. Then I need to indicate the time. I'm going to use standard time since I am not working in a hospital, which is open 24 hours a day. They use military time. I'm working in an outpatient setting, so I'm going to use regular standard 12-hour time, which means I have to indicate whether I administered this in the AM or PM. There are some evening hours at some outpatient settings, so you make sure you indicate whether this was given in the AM or PM. Next, I'm going to use the abbreviation patient instead of the patient's name because I'm actually in the patient's chart itself, so it is understood who the patient is because I've opened up the chart of that patient and now I'm looking at the records. So you do not need to write the patient's name here because it already is indicated when you opened up the electronic chart. Next, I'm going to type that I administered. Let's see, penicillin, 250 milligrams per milliliter. And I'm going to indicate the lot number and the expiration date. And this is there just in case we have any problems with the medication and we have to contact the patient about the batch and see if they have any reactions or if there's any recalls. Next, I'm going to indicate where I gave the injection. So it was an intramuscular injection that was given to the right. Sometimes when you're typing, it gives you this small little abbreviation. You don't want that. If you just hit delete, it will give you the standard parentheses with the capital letter in it. And I gave it to the deltoid site. The patient did state that they had no known drug allergies, and the patient had no adverse reaction. If they had a reaction, I would indicate what it was and what we did for it, but if the patient does not have any reaction within the next 10 to 15 minutes, then I would indicate there was none. I would do a backslash, first initial, last name, and then my title after. And that is how you document for any particular injection that you administer within your office.